Usually a joke in sleep medicine is that we evaluate people who sleep too much, who sleep too little, or who do weird things in their sleep. I'm Dr. Christopher Pham. I'm an assistant professor at WVU Medicine. I'm also the associate program director at the Sleep Medicine Fellowship program here. And I'm also the sleep lab director at the Pham Sleep Clinic. There's a few things that can cause you to do weird things. Some of them can be medically related, or sometimes it could just be normal things that actually most people experience or exhibit that we didn't realize is actually a pretty normal process of sleeping. But sometimes people will scream out in their sleep. They may reenact their dreams. Sometimes they may sleepwalk and don't realize it. And so those all play a different role, functions of different types of sleep disorders. I would say the most common sleep disorder is insomnia. And so that means I have trouble falling asleep, I have trouble staying asleep. And so then we try to evaluate, is there an organic cause for this issue? Or could there be another behavioral issue that led to your insomnia? I always tell people, if you don't have resolved issues when you're awake, it bleeds into the nighttime. So having a lot of stressors definitely can cause you to have difficulty falling asleep. We need a pattern, and we need a rhythm of how we stay awake and how we fall asleep. Sometimes we forget that during this holiday season, when we try to focus on our children or focus on our family members, we forget about ourselves, and that can lead to a little bit hard time winding down to fall asleep. And then the other role is you recognize with the daylight, daylight is at a limit right now, and seasonal affect disorder or seasonal depression disorder is a real thing, and that correlates with light. And sometimes that plays a role with sleep too. A lot of times people feel sleepy or more sleepy in general. We all talk about snoring as being a sign, but actually it's the absence of snoring is the true sign. So meaning you hear the snoring and suddenly hear a pause and the snoring picks back up. Now that's the apnea. Now there could be some brief moments where airflow does get through, so some gasping, choking in your sleep, that's another symptom. So some patients may tell me, like, I wake up with my heart racing too, and that's something that could be alarming. It's like my anxiety really picked up for some reason. I don't know what it was. That could be from sleep apnea, that you're waking up that way. Some people may have dreams of drowning, choking. That could be another signifier. Waking up with a morning headache, and this headache usually gets better through the day as you get more wakefulness. Another big sign is daytime sleepiness, feeling like you have to take a nap every single day, waking up not feeling well rested. Usually those are the big telltale signs. One of them is how many hours of sleep do I need? Everybody talks about 7 to 8 hours, but that's on a big average. If you look at specifically, it's give or take 2 to 3 hours. Some people only need anywhere from maybe around 6 hours of sleep and they're perfectly fine. Other people may need like 9 to 10 hours of sleep. So we realize there's short sleepers, normal sleepers, and long sleepers, and that actually still can be normal for yourself. The second one is REM stage being considered deep sleep, and which is false, because we recognize there's more than that many stages of sleep. There's light sleep, deep sleep, and REM sleep. And the reason REM sleep is not considered deep sleep is because brain activity is much higher. It's almost equivalent to that of you're awake. Actually, you shouldn't wake up somebody when they're sleepwalking. And sleepwalking occurs if your eyes are wide open too. And usually it occurs because you're actually in deep sleep. So we think that's kind of like your reptilian part of your brain taking over, meaning your reaction, your instinctual reaction just takes over. You shouldn't wake them up, because then they're at higher risk of hurting themselves, especially falling and hurt your head. And so that's why usually you just want to gently coax them back to their room or back to a safe place. Number one thing is tell people consistent sleep schedule. It's a loaded, topic, because you try to tell me fall asleep at the same time, but if I have insomnia, it's hard. But I usually tell people you can control when you wake up. So the wake up time is the most important thing. The second thing is to recognize what is your body's most preferred time to sleep. When you sleep matters too, because everyone has that circadian rhythm, and usually your hormones that gets secreted is based on your circadian rhythm. So recognizing the best times for you to sleep can matter too. Also try to keep in mind, typically it takes about 60 minutes to wind down before going to sleep. And it's a good time to start shutting down electronics. We do recognize in science that blue light is a very potent suppressor of melatonin. Now, I think any kind of light can suppress melatonin. And that's why I always usually tell people probably around 60 minutes is a good time to start winding down. And then the third thing is trying to get that morning light. Morning light really plays a good role. If you feel that right now there's not a lot of light out there, so using a light box or light therapy, it can be very advantage. You can get that online. What you're looking for is something that's measured in lux. So about 10,000 lux is what you're looking for. So the next step is that you talk to your primary care provider, say like a referral, or if you get a direct referral, then you see a sleep doctor. And then what we usually do is try to identify, could we do a home sleep study or an in-lab study?